After the age of 45 or 50, we men tend to have our prostate swell, increase in volume and size, which is called benign prostatic hyperplasia or BPH. Have you already seen a urologist for a checkup? After the age of 45 or 50, what do we need to do? The digital rectal exam, where the will be touched. Prostate is checked to see if it's the right size or not. But Juliano, how is it possible to tell that just by touch? Guys, the prostate feels like two little hills, right? So when you do the exam, you can feel that it's like two hills. And it has a consistency similar to the fibroelastic feel of our nose. And those of us who are trained for this, we know if the prostate is enlarged or not. It has a certain size, right? It's small, usually between 20 and 30 grams, and that's all good, right? So you do the exam, you feel that one side is huge like a mountain and the other is normal. Sometimes only one side of the prostate grows, sometimes the whole prostate enlarges. So this varies from person to person. But the vast majority of people, due to physiology, speaking in terms of physiology, have a tendency for the prostate to enlarge, for BPH to develop. Then you go to the urologist for a checkup and he detects this. Sometimes it's detected early, even when you're urinating normally and not having any symptoms yet. So the earlier it's detected, the better. Juliano, but what would be the symptoms of someone with an enlarged prostate, a swollen prostate? The symptoms are waking up more than once during the night to urinate. So it's normal, sometimes if you drink a lot of water, a lot of fluids at night, to wake up once to go to the bathroom to urinate. That's normal. Now there are people who wake up 3 or 4 times a night to urinate because you can't completely empty your bladder because the prostate is blocking it. It's making it harder for the urine to pass through because it has grown, you see, folks. And then you go, but you can't get rid of all the urine in your bladder. Some of it stays behind, and soon enough, your brain will tell you, You go to the bathroom, your bladder is full, but you can't empty it properly. Here's another tip I'll give you. When you go to the bathroom, take a look at your urine stream. Check it out. If it's very thin, you probably already have BPH. So the urine stream indirectly shows us whether the prostate is enlarged or not. Another tip, after a man urinates, he puts his penis back in his underwear and it wets the underwear. The person unintentionally says, oops, it's wet, the underwear gets wet and urine comes out. This happens a few seconds after he has urinated. How annoying is that, right? So that's already a sign that you might have BPH. Then you need to go to a urologist so he can confirm if that's really the case. Supplements, folks, that you can use to reduce your prostate or to prevent your prostate from enlarging. If you're under 40 years old, you can already start using them. So if you're already taking medication, keep taking your medication. Keep going. There's absolutely no problem, folks, if you're undergoing treatment. Keep taking your medication, but give your body some extra support. There are cases where surgery is necessary because it causes a blockage and the person can't go to the bathroom. The bladder gets enlarged and the person can only urinate in dribbles, the urine doesn't come out. It's a terrible ordeal. Then they do a transurethral resection, which goes through the urethra and widens the urethra again, which is being compressed by the prostate. Big. In other words, everyone has a way out. So if you have BPH, a swollen prostate, don't worry. Don't worry, there is a way out. Now you need to run after it. As soon as possible,